Welcome to our channel HASHMICLINICS.
Welcome everyone. Today we're going to conduct a real clinical deep dive into the homeopathic remedy Alumina Silicata. We're going to move way beyond the textbook basics to really get into its core identity and figure out how to apply it effectively in some of our most complex, chronic cases. Okay, so here's our game plan. We're going to build our understanding from the ground up. We'll start with the remedy's essential picture, then look at the mind, the body, the generals, and then finally, we'll nail down its precise clinical use with some prescribing pearls. All right, first up, the essential picture. To use a deep-acting mineral remedy like this one correctly, we first have to get a solid grasp of its fundamental nature. Understanding this nucleus, well, that's the key to ever even spotting it in the clinic. So what exactly are we working with here? As you can probably guess from the name, our remedy is a compound of alumina and silica. You might know it as kaolin or porcelain clay. And true to its mineral roots, this is a deep-acting remedy, really best suited for those stubborn, chronic complaints that are centered on the nervous system. Its sphere of action is incredibly focused. We're talking laser-focused on the neurospinal axis. So that's the brain, the spinal cord, and all the peripheral nerves. And this is precisely what makes it such a vital tool for some of the most challenging chronic neurological cases that walk into our offices. And if there is one single word you take away from this today, I want it to be this one: constriction. Now, this isn't just some minor symptom. It's a deep, pervasive sensation that the patient feels everywhere, internally and at all the body's orifices. So let's lock these three keynotes into our minds: constriction, formication, that creepy crawly sensation, and a deep spinal weakness. Just think of these as the three foundational pillars of Alumina Silica. I promise you we're going to see them show up again and again throughout the case. Okay, so we've got the physical foundation. Now let's see how this constricted state really manifests in the mind and the emotional sphere. The mental state is, well, it's a perfect mirror of the physical complaints. It's like this internal friction. You'll see a lot of dissatisfaction, a lot of anxiety that gets particularly bad at night. The patient can be really discouraged, very critical of others, and often suffers from this frustrating confusion of the mind, especially right when they wake up. And now for something fantastic. What we have here is a high-value, grade A, contradictory symptom. The patient absolutely desires to be alone, they want solitude, and yet they feel markedly better after telling their troubles to someone. This kind of contradiction, well, that's a huge signpost for a secure prescription. And as clinicians, we always have to be detectives, right? We have to ask why. With this remedy, make sure you're digging for a history where the patient's ailments really kicked off after a period of intense anger and vexation. All right, next up, the generals and modalities. This is the stuff that really helps us confirm our choice of Alumina Silicata over other similar-looking remedies. This is how we lock it in. Okay, here we have some very characteristic and peculiar physical generals. You want to pay close attention to a sensation of venous fullness. Also look for a distinct coldness that comes on with most pains, though, interestingly, not with headaches. And then there's this paradox. They crave open air, but cold air actually makes them feel worse. These are powerful confirmatory signs. This table, it's brilliant. It basically gives you the patient's operating manual. Symptoms are clearly worse from cold air, after they eat, and from standing, especially in the afternoon and evening. And what makes them feel better? Warmth, fasting, and resting in bed. It's a really clear and consistent pattern. So, let's follow the breadcrumbs. We're going to trace these guiding themes of the remedy through the major body systems and build a complete head-to-toe picture of the patient. Let's start at the top with the head and the respiratory tract. Right away, those themes of constriction and rawness just emerge with absolute clarity. You'll see constriction of the scalp, there's our first pillar. The headaches are better from heat, which is an interesting exception. And here's a fantastic keynote. The patient complains that inhaled air feels cold way up high in the nose. That pattern just continues down into the chest with a catarrh that has a raw feeling and profound weakness. Now, let's get to the real heartland of this remedy, where that neurospinal affinity truly shines. And this is where that core neurospinal affinity just comes roaring to the forefront. Our foundational pillars are crystal clear right here. We see aching and burning in the spine, There's formication along the nerve pathways, and you get this whole complex of heaviness, numbness, and aching in the extremities. Oh, and that soreness of the soles of the feet, that's a very valuable little particular to keep in your back pocket. Okay, so you've got this amazing picture. The big question is, where do you actually use it? Let's talk about its specific sphere of action in both acute and chronic disease. You know, the clinical range here is actually pretty broad. It can be indicated for a condition with a very clear cause, like lead poisoning. It can be an absolutely crucial remedy in severe acute crises, like croup or convulsions. But its primary strength, its main stage, is in those deep, long-standing chronic pathologies, things like chronic neuritis and debilitating nervous exhaustion. And you really can't talk about Alumina Silicate without mentioning this absolute gem from Dr. J.T. Kent. It's maybe the most famous keynote for the remedy, and it's a powerful reminder of its central role in managing chronic nerve inflammation. Now, in the acute sphere, its indication for croup is so specific, and you absolutely cannot afford to miss it. This is the remedy you pull out when your usual suspects, your aconites, your sponges, just aren't touching it, and the breathing has taken on this very distinct, deep, laboring, sawing sound that tells you that inflammation is seated way down deep in the lower trachea. And finally, let's sharpen our prescribing. We're going to compare Alumina Silicata to some closely related remedies. You know, this kind of accurate differentiation is what separates a good prescription from a great one. It's what secures the case and ultimately leads to a cure. So think about it. When a case of croup walks in the door, your mind immediately jumps to the common remedies, right? Aconite with its fear and suddenness, spongia with that dry seal's bark cough. But what sets Alumina Silicata apart? It's that sound. It's that uniquely deep, sawing respiration and the clinical certainty that the inflammation is located low down in the trachea. That is your key differentiator. So, to wrap all this up, what's the most crucial takeaway? I want you to always hold its 3 pillars in your mind: constriction, formication, and spinal weakness. With that core picture solidly established, I'll leave you with this question to ponder. In which of those difficult, long-standing neurospinal cases in your own practice might this remedy be the very key you've been searching for?
Professor Dr. Rafat Hashmi is a distinguished homeopathic physician, educator, and researcher with over 4 decades of clinical and teaching experience. He is widely respected for his deep command of Materia Medica, repertory, and constitutional prescribing, combined with a practical, patient-centered approach. Dr. Hashmi has dedicated his career to training generations of homeopathic doctors, blending classical principles with modern clinical insight. He is also known for his innovative work in digital homeopathy, developing educational content, clinical tools, and AI-assisted systems to enhance remedy selection and case analysis. With a strong commitment to ethical practice and lifelong learning, Professor Dr. Rafat Hashmi continues to guide, inspire, and elevate the standards of homeopathic education and patient care.